topic is about depressive disorder. It is one of the burdensome problem because of its recurrence, resistance, chronic nature and then suicidal ideation. We call it as depressive disorder according to ICD level if two clinical features are present out of three features, which includes low energy, low mood and loss of interest, which is called as the anhedonia, that is loss of interest in previously pleasurable activity. According to DSM-5 criteria, 5 features has to be present out of 9 features. What are these 9 features? Which includes depressed mood for more than 2 weeks, and second is going to be loss of interest. Next, third is going to be pathological guilt, which is an unnecessary guilt. Next, fourth is going to be energy is going to be decreased, leading to fatigue and tiredness. Fifth feature is going to be terminal insomnia, which leads to early morning awakening. Sixth feature is going to be concentration, that is decrease in attention. Seventh feature is going to be appetite is going to be decreased, leading to more than 5% of the loss of body weight over the period of 6 months. Eighth feature is going to be psychomotor activity, either that can be agitation or depression. Ninth feature is going to be suicidal ideation. So out of these 9 features, if any 5 features are present, it is called as a depressive disorder. So gradings of depression, it is graded as mild, moderate and severe according to on the basis of 3 factors, which include symptoms of depression, functionality and also vegetative symptoms, which include sleep and appetite. In mild type of depression, what symptoms of depression are present, whereas in moderate and severe, it is persistent. In vegetative symptoms like sleep and appetite, in mild type of depression, it is not affected, whereas it is affected in case of moderate and severe type. And also, the functionality is going to be normal in case of mild, whereas it is decreased in case of moderate and is severely affected in case of severe depression. Next, 2 signs in depression, which includes the omega sign and then you have the paragon fold. What do you mean by omega sign? At the root of the nose, we have 2 muscles, which is called as the poroceus, and then you have the corrugator muscle. In depressive disorder, in depression patients, so in patients with depression, these muscles are going to be contracted, leading to formation of the horizontal and then vertical fold. Next, you have the paragon fold. Around the eyelid, we have muscle called orbicularis oculi muscle. So these muscles are going to be contracted, leading to formation of the triangular fold. Next, what are the important aspects of depression is going to be? If usually only 1 episode of depression are experienced. If 2 or more episodes of depression experience, we call it as the recurrent depressive disorder or unipolar depression. So now there is the persistent depressive disorder, which is of 2 types. So dysthymia and then you have the chronic major depression. So dysthymia is mild sadness for more than 2 weeks, and chronic major depression is when depression is present for more than 2 weeks, we call it as chronic major depression. Next, you have the premenstrual dysphoric disorder. It is so in females before the onset of menstrual cycle. So depressive episodes are noticed, which can affect the quality of life, leading to dysfunctionality and distress. Next is going to be seasonal affective disorder. So patient experiences depressive episodes only during a specific season, mainly during winter, whereas during summer the patient is going to be normal. So next is going to be the biopsychosocial model. This model explains why patients experience depressive episodes. So 3 factors are going to be biological factors, psychological factors and then you have the social factors. In biological factors, which is mainly because of genetic predisposition, there is going to be dysregulation of the serotonin receptors, leading to decrease in serotonin, noradrenaline and then dopamine neurotransmitters, and there is also decrease in neuroplasticity, increase in inflammatory response. Psychological factor, 3 cognitive traits, which includes hopelessness, helplessness and then you have the worthlessness. And social factors, which includes unemployment, any financial issues. So social factors which includes unemployment, financial issues, loneliness. Next, it is a burden, as already told, it is a burdensome condition because of its recurrence. That is, one episode, if a person experiences 1 episode of depression, the chance 50% recurrence. If 2 episodes, 75% chance of recurrence. If 3 or more episodes, 90% chance of recurrence. Next, resistant. 10 to 15% of people are mostly resistant to the treatment, mainly which is an antidepressant. Next, you have and also chronic nature. It can persist for more than 6 months, 9 months, or even lifelong. Next, suicidal ideation. In 10 to 20% of people, suicidal ideation has been increased. So, treatment of depression mainly by pharmacological intervention, and then you have the psychological intervention. In pharmacological intervention, which includes SSRI, selective serotonin reuptake inhibitor. So, drugs included are going to be citalopram, escitalopram, fluoxetine, fluoxamine. Side effects are going to be GI pain, nausea, vomiting, sexual dysfunction, which lead to decreased libido, erectile dysfunction. Next, vivid dreams, which can cause insomnia. Second group of drug is going to be SNRI, selective neuronal reuptake inhibitor. Drugs included are going to be milnacipran, levomilnacipran, venlafaxine. By increasing the noradrenaline, it can lead to hypertension. Next is going to be tricyclic antidepressant. Fourth drug is going to be mirtazapine. So all these drugs has an important side effect of causing weight gain. Maximum weight gain is caused by mirtazapine. So, but an advantage of mirtazapine is that it does not cause any sexual dysfunction. So in patient with obesity, we use a drug called bupropion, which increases the dopamine and then noradrenaline. So by leading to which act as an antidepressant. By increasing dopamine and noradrenaline, it acts as an antidepressant. But an important side effect is going to be it decreases the seizure threshold. So it is avoided in patients with previous history of seizure episodes. Next, psychological intervention are going to be cognitive behavior therapy, and then you have the interpersonal psychotherapy. Next, solution focused therapy and psychodynamic and psychoanalytical therapy. We can increase the effect of these drugs by a method called augmentation, that is addition of one antidepressant drug with another antidepressant, or addition of any antipsychotic, lithium, or electroconvulsive therapy, and then you have the light therapy. It is also observed some medical condition can also produce depressions, which includes vitamin deficiencies like vitamin B, vitamin D, and folic acid deficiency, and chronic pain syndromes like rheumatoid arthritis and fibromyalgia. So correction of these factors has also been helped in treatment of depression. So what another important aspect is going to be, what do you mean atypical depression? In this type, patient presents with hyperphagia, carbohydrate craving, which can lead to obesity and increased sleeplessness. So duration of this treatment mainly of 6 months, but in some people it can extend up to 9 months or even lifelong, depending on the number of episodes. Usually following intake of any antidepressant, effects are observed after 2 to 3 weeks of treatment. Finally, coming to the end of this topic, we had learned how to define depression based on ICD level, DSM-5 criteria, gradings of depression, and why it is called as a burdensome feature, and biopsychosocial model. What are the 3 factors which play an important role? Biological factor, psychological factor, and then you have the social factor. And what are the intervention which includes pharmacological and psychological treatment, and how to augment these methods has also been discussed. Thank you.